Namaskar. A warm welcome to World News and Indian Perspective on All India Radio. This is Prashant Kumar Sinha, and with me is Reshma Tiwari, bringing glimpses of major developments of the day from across the globe. Over the next half an hour, we shall bring you the latest from the world of politics, economy, sports, entertainment and more. As the world fights the COVID-19 pandemic, we begin with a message of caution to stay safe and protected by following these three simple steps. Wear a face mask, maintain social distancing, and focus on hand and face hygiene. The headlines. Prime Minister Narendra Modi says Atmanirbhar Bharat campaign is a way to build an India that produces not only for its own needs but for the world also. India and China discussed this engagement issue at the 10th round of core commander level talks. New Delhi hands over 100,000 additional doses of COVID-19 vaccine to Mali. G7 calls for collective approach on China for fair multilateral global trade. World-famous Khajuraho dance festival begins in Madhya Pradesh, and in Australian Open tennis, Naomi Osaka wins the women's title, defeating Jennifer Brady. Novak Djokovic will face Daniil Medvedev in men's final on Sunday. Prime Minister of India Narendra Modi has said that Atmanirbhar Bharat, that means Self-Reliant India campaign, is the way to build an India that produces not only for its own needs but also for the world.
Secretary of State Antony Blinken, in a tweet on Friday,
आत्मनिर्भर भारत अभियान एक ऐसे भारत का निर्माण का मार्ग है जो न केवल अपनी आवश्यकताओं के लिए बल्कि विश्व के लिए भी उत्पादन करे और ये उत्पादन विश्व श्रेष्ठता की कसौटी पर भी खरा उतरे और इसलिए मैं हमेशा कहता हूं जीरो डिफेक्ट जीरो इफेक्ट.
In his opening remarks at the 6th meeting of the Governing Council of Niti Aayog, Mr. Modi said India has made up its mind to progress rapidly and doesn't want to lose time. The Prime Minister said the positive response received for this year's budget has expressed the mood of the nation, and the youth is playing a pivotal role in setting the mood. Mr. Modi said a holistic approach has been adopted over the years, from agriculture to animal husbandry to fisheries. He said as a result, the country's agricultural exports have increased significantly even during Corona. The Prime Minister said ease of living and ease of doing business will go hand in hand. The Prime Minister urged to focus on storage and processing of agricultural products to reduce wastage. He stressed on the need to export processed foods rather than raw foods to increase profits. Mr. Modi said reforms are very important for our farmers to get the necessary economic resources, better infrastructure and modern technology. The National Institution for Transforming India, also called Niti Aayog, is a premier policy think tank of the Government of India, providing both directional and policy inputs. The 10th round of core commander level talks between India and China are underway on the Chinese side of the line of actual control at Moldo. The two sides are likely to discuss disengagement from other friction points after disengagement from both northern and southern banks of Pangong Lake. The disengagement process of troops of the Indian Army and the China's People's Liberation Army from the line of actual control was reached after sustained negotiations at the military and diplomatic levels. Defence Minister Rajnath Singh last week said India's strategy and approach during the disengagement talks with China are based on the guidance of Prime Minister Narendra Modi that India will not allow an inch of its territory to be taken by anyone.
India and Maldives on Saturday signed agreements on a wide range of domains, including fish processing, public broadcasting, sustainable urban development, road infrastructure and housing. The agreements were exchanged after the talks between External Affairs Minister Dr. S. Jaishankar and his Maldivian counterpart Abdullah Shahid in Mali. The agreement in the field of broadcasting is for cooperation between Prasar Bharati and PSM, the official state media of Maldives. The MOU intends to facilitate collaboration and capacity building in the field of public broadcasting. Dr. Jaishankar and Mr. Shahid reviewed the entire gamut of bilateral ties as well as progress of ongoing bilateral projects and held discussions on the ongoing COVID situation, including India's continued assistance to the Maldives for its post-COVID economic recovery. Dr. Jaishankar also handed over 100,000 additional doses of COVID vaccine to Mr. Shahid and Maldivian Health Minister Ahmed Naseem. Dr. Jaishankar reached Mali on Saturday on the first leg of his two-nation visit to Maldives and Mauritius. The G7 countries on Friday said that they would seek a collective approach to China to counter non-market-oriented policies and practices and to ensure a fair multilateral global trade. Meanwhile, Japan's Prime Minister Yoshihide Suga has expressed concern about China's unilateral attempts to change the status quo in the East and South China Seas. US President Joe Biden and Italian Prime Minister Mario Draghi debuted at the G7 virtual leaders meeting, which was chaired by British Prime Minister Boris Johnson. The leaders called for stronger defences against a future pandemic, including exploring a global health treaty. They have pledged to intensify cooperation on COVID-19 and increase their contribution to the COVAX vaccine sharing initiative. In a joint statement released after a virtual summit last night, the G7 leaders raised their overall commitment to $7.5 billion. The move is expected to boost the distribution of COVID-19 vaccines to poor nations.
U.S. President Joe Biden has said that the countries have to push back against the Chinese government's economic abuses and coercion that undercut the foundations of the international economic system. He was speaking at the virtual Munich Security Conference on Friday. Mr. Biden added that the White House is reviewing China policy across all fronts, including China's military buildup and trade policies, its actions in Hong Kong, treatment of minority Uyghurs in Xinjiang, and its handling of the coronavirus outbreak. Speaking at the event, NATO Secretary General Jens Stoltenberg said the rise of China is a defining issue for the transatlantic community with potential consequences for NATO's security, prosperity, and way of life. The United States has officially rejoined the Paris Agreement, a report.
Secretary of State Antony Blinken, in a tweet on Friday, said, "It is a good day in our fight against the climate crisis as the United States is once again a party to the Paris Agreement." He said, "The work to reduce U.S. emissions has already begun. The U.S. had officially exited the agreement late last year on the order of the then President Donald Trump. Under the Paris Agreement, countries are expected to enhance their commitments to curb greenhouse gas emissions every 5 years. The goals of the Global Pact are to limit global warming to well below 2 degrees Celsius and pursue efforts to limit it to 1.5 degrees Celsius. UN Secretary General Guterres welcomed the return of the United States as restoring the missing link that weakened the whole, but warned the road ahead will not be easy.
This is All India Radio giving you the news. For quick news updates round the clock, follow us on Twitter at AIR News Alerts.
More than 100 million beneficiaries have been administered COVID-19 vaccines in India so far. The Health and Family Welfare Ministry on Saturday informed that 500,000 beneficiaries have been inoculated with COVID-19 doses in the last 24 hours. Meanwhile, the country's COVID-19 recovery rate reached 97.27%, with the total recovery of more than 10,307 patients within 24 hours. In our hotspot segment today, we bring you a discussion with Dr. Rodrigo H. Offren, the WHO representative to India, on India's stellar role in tackling COVID-19 pandemic.
Hello and welcome to this edition of Hotspot on the World News. Today we have with us Dr. Rodrigo H. Offren, the WHO representative in India, to tell us more about the role of the world body and how it's working in close coordination with the government agencies in India. Welcome to the show, Dr. Offren.
Thank you very much.
Dr. Offren, the year gone by has been a challenging year for mankind, physically, emotionally, as well as financially. The COVID-19 pandemic and its aftermath have really dealt a major blow to the health systems across the globe. Let me ask you, what has been the response so far, and if it has been effective enough in tackling the challenge?
It's not known to many people that a big part of the WHO program is actually pandemic preparedness. So there were capacities being built in different countries at different levels. We were not starting from zero. In all countries, including India, there are lots of capacity. But the issue is that this pandemic is really beyond the scale of anyone can imagine. We did not have the same scenarios in mind. WHO helped forge unprecedented partnerships with countries, scientists from the most leading academic and research institutes, industry and philanthropies that has become a blueprint for global response to future health emergencies and pandemics. And lastly, a big part is maintaining health services and supporting health systems. Other non-COVID health services needed to continue, whether they were for maternal child health or vaccination or even TB care. To end this pandemic, the response cannot always be in the hands of experts or doctors or clinicians, but in the hands of the public. So the COVID-appropriate behaviors, as we call them in India, is the most important response, especially up to now. If we're able to do the 3 Ws of washing our hands often, wearing a mask, and watching out our distance from crowds, this helps stop the transmission of the disease.
A lot of questions were asked and are still being asked about the role of WHO in whether the world body has lived up to its expectations, whether the spirit of collaboration, has it really worked?
WHO is an organization of member states. Countries are the members of this organization. So to ask if WHO has really lived up, it's also up to our member states who have been participating in this whole response. As staff, our secretariat to the member states in this regard. And as I told you, this is how we managed the response and putting a frame to the response globally so that the pandemic can be consistently addressed everywhere. Collaboration has worked, definitely. I think just to have a picture right now in terms of whether it was information being shared, samples being shared, countries openly reporting about their cases, we have seen that this is happening everywhere, and countries are very much participative in this collaboration. I talked to you about the ACT Accelerator. That has come from collaboration of so many countries in terms of having tests and therapeutics in trials. We call them the solidarity trials, and they're in multiple locations in many parts of the world to share that information so that we're able to have evidence for our upper response. As the pandemic was spreading and as also the countries were starting to open after the lockdowns, the sharing of resources, provision of supplies, opening airways and air lanes and airlines so that deliveries of the essential supplies were happening was also happening in countries. So this is all happening. Collaboration has worked and will continue to needs to be the cornerstone for preparedness and capacity building for future-proofing the world from future pandemics.
As the COVID-19 pandemic spread globally, it has also affected several ongoing healthcare programs and initiatives towards meeting the achievements of SDGs. Has it cast a shadow specifically on SDG number 3?
And I'll bring you back to one of the core pillars of our response, which is maintaining essential health services, meaning that no other health services should stop because the resources and a focus of such is towards ending the pandemic. It did happen. Many of our healthcare workers were deputed to manage whether they are wards or primary health centers, or if they are designated, if they become designated COVID hospitals, or even surging capacities for laboratories. For many of our medical technologists, there was a focus on that at the outset. But right away, we were all saying that this should not happen. We should not witness, for example, a cases or an outbreak of diseases that already have a vaccine that's proven for them. Let's say polio, measles, etc. That should not happen. So yes, there was a setback initially at the outset, but because of the efforts of many governments and our discussions with them to how to do this, services continued. Routine immunizations have not stopped. There may have been delays in the big subnational immunization drives, but that's now back all on schedule. And the government of India and health services have done very well. So to your question, yes, there is a bit of a setback, but it was also an opportunity to reinvigorate and innovate. And in the larger future, we should be able to see achievement of SDG 3 with a lens in which it will be a health system that is resilient to any other public health emergency or big emergency.
Listeners, we are in conversation with Dr. Rodrigo H. Offrin, WHO representative in India, on the role of world body in tackling the challenges in COVID era and its association with India. The vulnerable groups, the poor, migrants, weaker sections of the society, the women and the children, they have suffered most. Have we assessed the impact and how does it augur for the future?
Indeed, COVID-19 has exposed gaps in certain sectors of society, including women and children. Globally, we have also seen that it has exposed gaps in public health delivery at global, national, subnational level in different countries. In 2020, children and adolescents under 18 accounted for around 8% COVID-19 cases, although they comprise 29% of the global population. So if you look at it, that's why the focus on COVID-appropriate behaviors is primarily also on the youth. That's why the governments have really made efforts to ensure that there is no denial of essential health care, especially for child and maternal services.
It is said that the challenging times require equally forthright a response. We have seen how the doctors, the health workers, the nurses, the ASHAs, ANMs, paramedics, sanitation workers and other frontline workers have really worked hard as corona warriors in meeting these challenges. COVID-19 pandemic has seen how a unified effort can really overcome these challenges. How can we further strengthen them?
One is very good training for healthcare workers. Two, providing them the necessary protective equipment as needed. Having an infection prevention control program in health facilities is another. So there should be a supportive environment for your healthcare workers. The other is career tracks. We have public health servants, public health staff they're working in emergencies as surveillance officers, as contact tracers, etc. What is their track towards a public health emergency track? Maybe that's another way to keep having a workforce that is resilient to any possible emergency. The other more important thing also is their own welfare, their mental health, the kind of counseling and support that healthcare workers get. So that all needs to be planned.
The future really holds in store what we call the reimagining of the healthcare system. We have seen how India has been able to bring down the number of active cases. What would you attribute this to?
It is about fundamental public health responses and actions, which is summarized, of course. You've been hearing this a lot. Detecting cases. What is your surveillance system out there? Your contact tracing. How do you get their contacts fast? And the testing, because right away you have to be able to test and know whether people are positive or not, and therefore the next point is isolate and care. So throughout this pandemic, I've seen that in India, as far as possible, all the states were pushing for this. This was our key advice. It's really pushing for these areas of public health response. As we moved further, we also saw that India became self-reliant with a lot of these supplies. So it provisioned and easy access of PPEs, of essential equipment, essential medicines to support the whole response. The use of technology is something we also saw. You had Arogya Setu as an app that was a proximity app to get people to know what's going on. The Prime Minister himself has called for a Jan Andolan on COVID. So the whole response is moving quite well. And now also a very concerted, meticulously planned, meticulously rolled out vaccination drive. This is another kind of remarkable response from the country.
In a post-COVID world, the focus is now on vaccines. India has already started the world's largest vaccination exercise. How is its progress going on and how is WHO supporting in this endeavor?
Vaccination is one of those public health responses. First of all, it's a remarkable thing that several vaccine candidates have been developed within a year of this pandemic. If you're asking about our role, we have been involved in this, and I keep thanking the teams in WHO that have been involved in this for some time now, and we have provided technical guidance, including sharing of technical materials for vaccine development right at the outset. That was what WHO was providing. Track the task forces and their regular meetings, provide issues that need to be discussed. In this whole preparatory phase, we have been side by side with Ministry of Health in terms of refining the operational guidelines that have been rolled out and which you will see uniformly implemented there in every PHC or vaccination site. Trainings have been conducted, the development of training materials specific to the India health system. We have identified rapid response teams for deployment to support vaccination response, because we do have a role as WHO in terms of, as provided by government, in terms of monitoring the session site. Are they up to the standards and the operational guidelines issued by the Ministry of Health and Family Welfare? We have also provided some support to the communications that go out to provide the technical vetting for some of the messaging.
Dr. Austin, last but not the least, you have been closely involved in emergency preparedness on behalf of WHO, and you have handled several emergency situations. How do you look at this COVID pandemic in the years to come? What lessons has it conveyed to us as a humanity?
Well, I think the overarching lesson for all of us is something on humility. That, no one country, no one expert, no one ministry knows everything at any point in an emergency. We should never assume. The pandemic has hit hardest at countries that supposedly had very, very good health systems and medical systems. And that's a learning for all of us. We should see that also that resilience is something that you constantly learn. So that's probably the second lesson, that as this response was ongoing, we were all learning. And lastly, to look at how countries have emerged from what they have innovated. I've mentioned so many for India, but also to see that from a response point of view, now India is contributing to the world response, which is so commendable, whether it is for PPE equipment provision, essential medicine provision, but also the vaccines. I think that's so commendable that India has come out providing vaccines to neighboring countries, and also together with it, the information platform in which this may be rolled out is something for being offered for other countries to consider. So from a responder for the country to a responder to the world, India as not just a pharmacy for the world, but also a responder for the world, providing all that support to other countries, our neighbors practically first, and then I'm sure it will redound to a larger impact on ending the pandemic. So in essence, from this pandemic, I think a better prepared India is a prepared world. We have seen this in terms of the contribution now of India to the response.
Thanks a lot, Dr. Austin. Well, listeners, that was Dr. Rodrigo H. Austin, WHO representative in India, sharing his insights into the shape of things to come in the wake of COVID-19 pandemic and the role of WHO and its quest for a better and healthier future for mankind. Thanks for joining us. Have a great day.
Moving on to global coronavirus updates. U.S. land borders with Canada and Mexico will remain closed to non-essential travel until at least March 21st. Meanwhile, major U.S. airlines on Friday said that they would adopt a voluntary international contact tracing program to tackle the COVID-19 pandemic. Russia on Saturday approved a third coronavirus vaccine, Covivac, for domestic use. Underlining the importance of universal vaccination, German Chancellor Angela Merkel said that the pandemic is not over until all people in the world have been vaccinated. New Zealand on Saturday started its official rollout of Pfizer-BioNTech's COVID-19 vaccine.
Russia on Saturday said that its scientists have detected the first case of transmission of the H5N8 strain of avian flu to humans and alerted the World Health Organization. In a television interview, the head of Russia's health watchdog, Rospotrebnadzor, Anna Popova, has said that information about the world's first case of transmission of the avian flu H5N8 to humans has already been sent to the World Health Organization. NASA has presented striking early images from the picture-perfect landing of the Mars rover Perseverance. Among the scientists who are part of this historic Mars mission, Indian-American Dr. Swati Mohan led the development of altitude control and the landing system for the rover. Besides that, she was the lead systems engineer throughout the development. She is the key communicator between the GN and C subsystem and the rest of the project teams. According to NASA, she has worked on Mars 2020 since almost the beginning of the project in 2013 and is currently working at NASA's Jet Propulsion Laboratory in Pasadena.
Marking a violent turn in the ongoing protests in Myanmar, 2 protesters were killed in police firing in the second largest city of Mandalay on Saturday. Earlier, one young student died on Friday after she was injured 10 days back in police firing in the capital city of Naypyidaw. With the latest deaths, the number of protesters killed in Myanmar agitation has gone up to 3. The military government has also claimed that a policeman had been killed after he was injured by protesters. The week-long 47th Khajuraho Dance Festival began this evening in Khajuraho, the Indian state of Madhya Pradesh. The festival is based on the Indian classical dance tradition. More from our correspondent.
On the first day, along with dance performances, tourists also took part in e-bike tour from West Group of Temples to Eastern Group Temples, village tour of Old Khajuraho and many more. The first day event is dedicated to Bharatnatyam performance by Geeta Chandran and her troupe and Kathak performance by Deepak Maharaj. The festival is being organized by the Culture Department through Ustad Alauddin Khan Music and Arts Academy Bhopal. Director of the Academy, Mr. Rahul Rastogi, has said that this year festival will give the audience a chance to watch the performance of the dancers amid the aura of the temple, as after a gap of 44 years, event is being held once again in the temple complex of the Western Temple Group of Khajuraho. Pooja P. Vardhan, AIR News, Bhopal.
And now let us take a look at the major developments around the world as reported in the foreign press.
Global Times reports that US lawmakers denounce surge of anti-Asian violence amid pandemic. The Sydney Morning Herald writes that US President Joe Biden has called on Europe to prepare for long-term competition with China. The Washington Post reports that Biden tours vaccine plant in Michigan pushes $1.9 trillion COVID relief package. Khalij Time writes that UAE expresses grave concern over deteriorating situation in Somalia. And The Guardian reports that Alexei Navalny loses appeal against Russian prison camp sentence.
Moving on to sports, in tennis, Japan's Naomi Osaka cemented her place as the outstanding star of the women's singles game by beating American Jennifer Brady in the Australian Open final to win her 4th Grand Slam title. In the mixed doubles, Barbora Krejcikova of Czech Republic and Rajiv Ram of US clinched the title. The men's singles final will be played tomorrow. The title will set up a blockbuster against world number 1 and defending champion Novak Djokovic as Medvedev searching for his Grand Slam title.
In Bangladesh, Prime Minister Sheikh Hasina has honored the prestigious Ekushe Padak 2021-21 eminent personalities in Dhaka on Saturday. Amar Ekushe Day is celebrated on the 21st of February to honor the martyrs of the language movement of Bangladesh. A quick look at the headlines once again. Prime Minister Narendra Modi says Atmanirbhar Bharat campaign is a way to build an India that produces not only for its own needs but for the world also. India and China discussed this engagement issue at the 10th round of Corps Commander level talks. New Delhi hands over 100,000 additional doses of COVID vaccine to Mali. G7 calls for collective approach on China for fair multilateral global trade. World-famous Khajuraho Dance Festival begins in Madhya Pradesh, and in Australian Open tennis, Naomi Osaka lifts the women's title, defeating Jennifer Brady. Novak Djokovic will face Daniil Medvedev in men's final on Sunday. India is celebrating the 151st birth anniversary of Mahatma Gandhi. Before we end, let's listen to his favorite bhajan, Vaishnavajan, by artists from Norway. And with that, we end this bulletin. See you at the same time tomorrow with the next edition of World News.